As I told you, we have today a chapter which is very interesting about cardiac stress test. What we mean by this? You know that when we apply stress over the heart, either physical or mental or chemical, we have to look for how the heart is working. Can the heart accommodate? Can the heart respond perfect, or the heart is unable for doing extra job? So why we do stress test? First of all, if I have a patient and the patient coming to my clinic and say that I have symptoms, and when I listen to the symptom coming from the patient, I noted that this is looks like he has something problem with the heart. It's okay. Let us do EKG. I do the EKG and I find that everything is perfect. So what do you think, guys? If I have cardiac symptom, but the patient say that this happened like frequently, many times for the last week or last month, and when I perform EKG, I find that he is totally perfect. Should I ask him, it's okay, you are fine, you are good, go home? Of course, this is not should be done. Why? So far, there is a symptom. We have to investigate about this symptom. First of all, if we do EKG and we find that the EKG is okay, so this is okay. Why? Because the patient is at rest. The patient is lying on his back. The patient is in a comfort couch. The patient is prepared himself for the EKG. Of course, maybe the EKG comes without any abnormality. So in such condition, we have to shift to stress test. Why? We are going to apply extra effort like exercise. When the patient do exercise, or the patient go upstairs, or the patient is exposed to stress, mental stress, emotional stress, whatever stress, we start to get the complaint. And according to this, we have to realize that this is completely free from any pathology, or we have to pay attention and take action. So how we perform the stress test, and what is the indication, and what is the contraindication? Not all patient is suitable for stress test. Sometimes if I have a patient, we will see now the indication and contraindication, with recent infarction, and I do stress test, I am going to put the patient in trouble. Why? Because the patient is not subjected or not doing good for this extra effort. Let me share with you this chapter. As I told you, it is not in your book, but I'm going to provide the slides and also the video as we used all the time. So what is the name of this chapter? It is cardiac stress test. Let us see. We have here short history. Don't worry about this. It is not important, but from here we need to pay attention. What should or what we expect to be happen, or what we expect as a result, or what we expect as a finding when we do the exercise test or any stress test. Let us have, we are familiar about the treadmill, and treadmill is exercise, okay? And after that, we are going to talk about another stress, which is by medication. So what you expect when you are doing exercise, running, go upstairs, hurry, whatever, what you expect? Your heart rate increase or decrease? Of course, normally it is increased. This is the normal, right? So increased heart rate is a normal finding when we do exercise. But if we noted that the heart rate is not increasing but decreasing, Definitely in this situation, there is something wrong. We don't go to complete the stress test. So number one, they will ask you in the exam about what had happened during stress tests, what you expect, increase heart rate or decrease heart rate. Normally, it should increase. Okay, then when we have this increased heart rate, we will get also increased stroke volume. If you go back to the information which we had before in first 3 chapters, we mentioned what is the stroke volume. It is the volume of blood ejected in one beat. So due to extra demand of blood, so this stroke volume is going to be increased, right? Make sense? So we have increased heart rate, we are going to get increased stroke volume as well. Then what you expect? Increased blood pressure. Okay, increased blood pressure. This is very important. Sometimes we notice that although both systolic and diastolic blood pressure generally rise, this is normal, but sometimes we notice that the diastole is like getting less. And this is like a warning sign. We have to be careful about this. Then, what do you think the peripheral resistance? When we run, what you notice, when you run, when you do exercise, you find that your hands, your face, your feet getting flushed. Why it is flushed? Due to exercise, the capillaries in the periphery will be dilated and will like accommodate more blood. So this means what? The large capillary bed and muscle dilate to accommodate increased blood flow. Their need of more oxygen. We are doing exercise, we need effort, we need like extra blood and extra oxygen to be provided to the muscles and so on. So this what the peripheral resistance will develop. It is going to decrease. Okay, this is very important, ladies. I need you to pay attention for this issue. When we do exercise, the peripheral resistance will decrease, dilated, and the blood will go to the periphery. So some people, after excessive exercise, they took hot shower. And of course, this will add more dilatation to the periphery of blood vessels. So it will make more drop of the blood pressure. So what happened? We get fainting. So this is question in the exam regarding it is wise to take hot shower after stress test? No, we don't recommend this. Take care of this, okay? Then, what is the myocardial oxygen extraction? When the heart needs extra job, it needs extra oxygen. This is why when we do the stress test and we find that the patient start to be unable to accommodate for the stress test, this means the amount of oxygen going to the heart muscle is not enough. This is why he start to develop chest pain. So if there is coronary stenosis, what is the word stenosis? Stenosis means narrowing. Coronary stenosis. So it is not possible to increase the coronary blood flow, and according to this, the patient will start to suffer from angina pectoris. And I told you in the previous lecture what we mean by the word angina and pectoris. Here, this is the angina pectoris, which is chest pain. As I told you in the previous lecture, it may be typical, related to the heart location, or atypical, like we had the previous slides, that it may radiate to the mandible, it may radiate to the shoulder, left shoulder, and inner side of the left arm, and back, epigastric. All of these are of great importance. You have to be aware about this. And I would like to tell you a story which is like very nice. One of your classmates, one day she called me around 6:15 p.m. and she was so happy. And she told me, Dr. Israel, I am so happy about what I did for today. I said, what you did? Let me happy too. She said, we are about to close the clinic, and one of the patient came with pain in his mandible, severe pain. And they are like willing to close and finish. And she was smart. She said, let me double check the EKG. And she performed EKG for him, and she noticed changes in the EKG due to coronary insufficiency, and he has atypical angina pain in his mandible. And she called her provider, and he approved the diagnosis, and he was so happy for her that she picked a typical case of cardiac or chest pain, and they of course take care of this person. And this is very important for you. Keep in your mind that maybe you face someone with pain which is not typical. Don't say that this is not typical pain coming from the chest, so it is not from the heart. No. And very common, ladies, some people, they have pain in the epigastric region. Where the epigastric region? When the lower border of the ribs met together. So you will say that the heart is not here. The heart is in the upper left part of the chest. No, maybe like what we call heartburn. Heartburn. So this heartburn may be due to gastric problem, or maybe referred pain to the epigastric. So gastric pain is very warning sign and symptom. Sometimes the patient call me, say that I have heartburn. I would say, okay, do you have this experience before? He said, yes, many times. I said, okay, try to take like antacid. I don't have antacid. Okay, drink cold milk. Okay, he drank cold milk. After 10 minutes, he is not improved. So it is not coming from the stomach, it comes from the heart. So even over the phone, we can realize what is going on with the patient, and I advised him immediately to go to emergency room to check for his EKG. Then we have another response, which is like shortening of breath. Claudication. What is claudication? Claudication. Sometimes you pronounce claudication, but both are correct. Claudication, which is mean, it is pain in the calf muscle during the exercise. Like sometimes when we are like we will not prepared our body and we start to swim or to run, we find that we got cramp, and this cramp is in the calf muscle. So this is what we call claudication. Fatigue in early stages of the test, and fall and blood pressure. I told you it should be like rise in the blood pressure. Then what we need to know about this subject is to prepare the patient for stress test. Like what? Number one, no solid food. Take care of these items. It is very important, and I will let you know that which one is going to be interesting. No solid food 6 hours prior to test. He can drink any fluids as he like. Restrict fluids except water. Why? Because fluid, maybe some fluids like contain some allergies, some like stimulants, and so we don't need all of these. So water, it's okay. Restrict, pay attention for this one. Restrict caffeine 24 hours prior to test. What is the rule of caffeine? Which caffeine? We have caffeine in coffee, of course. Which type of coffee? Which type of coffee? Actually, we need to be familiar about, we have many forms of coffee, and the one which we are talking about it is the Turkish coffee. The Turkish coffee. And this Turkish coffee is like containing volatile oil, and this volatile oil is very strong. It contains something which we call aminophyllene. So this aminophyllene, I need you to pay attention to the name, aminophyllene. We're going to get the slide for that. So this caffeine is like increase strength of the cardiac muscle. So this means if I drink this caffeine before the EKG, okay, Cameron, I am going to pass the exam, but actually I have problem. So this means like stimulant to the heart. This is why sometimes they say that coffee is very good to the heart, but not like, sorry to say that, not apply for Nescafe, not apply for American coffee, nothing. It is not the same situation. Restrict smoking on the day of the test. Use loose comfort clothes and rubber soled shoes, and restrict medication that alter the heart rate, like what we mentioned in the previous lecture, like beta blocker, calcium channel blocker, and digitalis or digoxin. And bring list of medication. Why we have to bring list of medication? Because maybe the patient develop problem with the exercise, and I need to restore the health or the situation of the patient. I'm not going to make a prescription and go to the pharmacist. No, we have already the medication given to the patient, like I told you in the previous lecture, nitroglycerin, sublingual, and it will like provide dilatation to the coronary, and of course will provide more blood and more oxygen to the cardiac muscle if chest pain develop. This slide is very important. What are the most important items here is caffeine 24 hours and medication, and this medication is like to restrict and bring the list of medication. Take care of this, please. Then we prepare the skin by like adequate scrubbing, possible hair clipping, and use of reliable electrodes, and starting the like we are very important to minimize motion artifact, and this happen during exercise when we are doing this test with female breast. Like we mentioned before, the electrodes can be applied. We mentioned that we have 10 electrodes, if you remember, and any part of the limb represent the limb. This is why, as you see here, the right arm and left leg and right leg, all of them can be like applied to the very beginning of the limb, but V1, V2, V3, V4, V5, V6 are applied as normal location. Okay. Then we are going to do EKG before doing any exercise. And this is why we do this. This is another question at the exam. Why you have to perform EKG before, during, and after? Before, to evaluate what is the situation of the heart of this patient. He is okay now, or he has already infarction. And I told you that elevation or depression of ST segment is indication that there is infarction. So if there is like recent infarction, I'm not going to do EKG stress test. I'm going to hurt my patient, or patient may die. So within 3 days of recent myocardial infarction, I'm not going to do stress test. Clear? So why I have to make like, this is what we call baseline evaluate about the patient condition. What is the heart now? And after that, we are going to take the vital signs. What the importance of this vital sign? We need to count the heart rate. We need to know what is the blood pressure. Okay, all of these are of great importance. Why? Because when I finish the test, I have to restore this situation back to the patient. I'm not going to allow the patient to go home while his blood pressure is still high. I'm not going to allow the patient to go home still having very fast heart. So we have to be like having what we call baseline EKG and take vital signs. I hope it is clear. And if you have questions, let me know. So as you see here, we are doing pre-test. What is the technique? Supine baseline EKG blood pressure, hyperventilation for 15 seconds, and actual exercise. And after doing the exercise, we put the patient to get into recovery to restore back the baseline EKG and baseline vital signs. EKG findings to consider prior to exercise patient. AF, what is AF? Atrial fibrillation. Okay. Short burst of VT. What is VT? Ventricular tachycardia. So this can be like warning to me, take care. Okay. EKG changes require regular stress test. We have what we call left bundle branch block. This is LBBB. LBBB means left bundle branch block on the baseline. LVH, left ventricular hypertrophy. So what is the situation here? The ST segment depression on baseline. So all of these changing irregular exercise stress testing.
Doctor, what LVH stand for again?
Left ventricular hypertrophy.
Okay, thank you.
Hypertrophy means enlarged in size. Okay? Left ventricular hypertrophy. What is the contraindication you see now? Contraindication means I am not going to get like permission or wise to do this EKG stress test. As I mentioned, within 3 days of myocardial infarction. So never do exercise stress test. Another condition which is unstable angina. And when we go with circulatory system, we are going to learn that angina, which is chest pain, can be like stable and unstable. And unstable means what? It happened during rest, but the majority should happen at exertion. We call it is stable. Stable angina means all the time which we have stress, it will be show up. Serious cardiac arrhythmia, severe aortic stenosis, severe hypertension, severe claudication. So all of these will not give me a chance to do exercise stress testing. What should we expect for normal EKG changes during the exercise? The PR interval, and I would like to ask you, and this will be exam question, why the PR interval is getting shorter? Because of tachycardia. This is the answer. Because of tachycardia. And P wave will be like more taller, because we know that it is smooth and upright, but here it will be a little bit taller. Downward displacement of PR junction, R wave amplitude tends to decrease, T wave may become taller, ST segment may be steeply up sloping and should return back to normal baseline within 0.04 or to 0.06 seconds. This means 0.04 means small box, 0.06 means 1.5 small box. So these normal changes happen during EKG stress test is of great importance, and I need you to remember this. This number is very important regarding the ST segment, okay? What is the abnormality? Like I told you, the ST segment depression more than 1 millimeter. ST segment elevation, serious arrhythmias, heart block, hypotension. Should be hypertension, but if it happened to be opposite, so this means there's something serious. Okay, so be careful about the abnormal findings, and this is question in the exam telling you that ST segment changes indicate what? You have to stop immediately the stress test. Like we mentioned that we have two types of stress test. One is by treadmill, which is very common to all of us, which we call regular cardiac exercise stress test, treadmill, or we have another one with nuclear imaging and also stress test with echocardiography. Here is a very important subject. We apply stress test without making any exercise by medication. What this medication? We have two medication. I need every one of you to pay attention for them. Perzantine and adenosine. Perzantine and adenosine. Like what? If I give this perzantine or adenosine to the patient by intravenous methods, as if I am giving extra effort during exercise. So the heart is like overwhelmed, okay? Like we do exercise. So if I inject these two material, it will be like making more load on the heart. And if there is something wrong with the heart, it will show up immediately. Here is the question in the exam, and I need you to save it. What is the heart rate for exercise stress testing? Never exceed this number. Look, guys, 220 minus the age of the patient and the outcome multiplied by 0.85, it will be the target heart rate. This means what? Suppose the age is like patient with 70 years old. So 220 minus 70 and the outcome multiplied by 0.85, and we will get, this is like the maximum of heart rate. If the patient reach to this number, we have to stop the stress test. So far the heart rate is below this number, we can keep going with the test. But if we reach this number, it will be very risky to complete the heart rate. Please save this formula. What should we instruct the patient during exercise? We say that walk normally, staying close to the front hand rail, hold on the front, and don't bend your arm when you, because we are going to attach cuff of blood pressure manometer. So we have to give an instruction that when you feel the cuff is inflating, extend your arm. So extend arm when blood pressure recording is needed. Don't jump while the treadmill is in motion. Verbalize symptom. This is important. You have to emphasize with the patient. Verbalize symptoms. Like I start to feel pain, I will say, I have pain in my, I have claudication or pain in my calf. I have to say that. Why? When the patient can give you the verbal symptom, we have time to save the patient. But if the patient keep quiet, not giving you any warning, so the patient will be like in trouble if I'm not notice what is going on with the patient. So any symptom will develop during the exercise has to be verbalized by the patient. Take care of this item, it is questioned in the exam. Then we go to the recovery, and as we know that we already evaluate the patient condition before the stress test, so we have to restore back all the, like I know that before the test, the patient heart rate is like 75. So I have to keep quiet till the pulse come back to 75. And so on. The blood pressure also come to the baseline. And we do EKG and we restore the typical picture of the baseline before the stress test. Okay? Some patients, they may need more time for recovery. It's okay. And this is the question, as I told you, caution on hot shower immediately after stress testing. And this is question of the exam. Why? I told you that the peripheral resistance is decreased and it is dilated and it will accommodate amount of blood, so it will make fainting and drop of blood pressure with the patient. After we doing the stress test by the medication, when we do the treadmill, it's okay. Treadmill, I will stop the machine, I'll stop the exercise. But if I already use the medication, how can I withdraw this medication? There is no way to withdraw, but I have to give antidote. Anti means against, antidote to restore or to eliminate the effect of this perzantin and adenosine. What is the name? It is aminophylline. Save it. Aminophylline 125 up to 250 milligram intravenous. It will compensate the effect of stress test medication. And this aminophylline is like caffeine. You see, caffeine is exactly similar to aminophylline. So this is why we restrict intake of this caffeine before the test by 24 hours. So take care. It is nice subject, interesting subject, and all of this information will be very interesting for you to know and practice, of course. Okay? Then we are going to get some more information, but it is more advanced. It is not related to the level of your knowledge. But I think if it is necessary, just read it. But for the items which I told you regarding here, look, the stress test here and the ST segment here is depressed, here is elevated, and here it is within normal. So this is very important for us to recognize the changes with the ST segment. And after that, we have here like summary, and don't worry about this. It is like more advanced, and I hope you learned something interesting for today. I will post the PowerPoint, and also I'm going to post the recorded video, and I wish everyone learning something beneficial from this chapter. We will stop recording.